Okay, so now I will talk about more specifically about some research we conducted as part of the hub. One of the premises on which the hub relied was the fact that in many settings we can have access to reasonably large amount of data at an aggregated macro level about the evolution of the production system, and on the other hand, very detailed molecular data on pathogens which are affecting the system. But we are missing on-the-ground understanding of the behaviors which underlie these observed patterns. And it is what the hub aimed to do, to characterize, to better understand the interplay between the socio-economic context, the actors' behaviors, the resulting configurations of production and distribution networks, and zoonotic disease risk. And I will illustrate the interdisciplinary approach that we adopted to do that with the research we conducted on avian influenza in Bangladesh and in Vietnam. So we started by characterizing the networks. We first identified the types of roles that actors occupied in these networks, and we went beyond the description of the flow of commodities between sites to assess how the dynamics of this role affects and is affected by the structures within which actors operate. So for instance, in Bangladesh, the transaction dynamics was influenced by a complex mix of unpaid domestic labor, patronage, and various forms of value appropriation. The lack of access to financial capital meant that farmers needed to request credit from suppliers in order to get access to production inputs, which placed them in trade tying agreements and in price fixing contracts. In Vietnam, farmers adopted different livelihood strategies, and the capacity to adapt to a very volatile sector was really crucial in order to ensure the resilience of the farm. And a feature that was shared with Bangladesh, it was the search for stretching the profitability of the farm, which pushed them towards making decisions towards short-term goals rather than long-term considerations, with the adoption of reactive rather than preventive measures. And these had consequences epidemiologically. So from this initial qualitative characterization of the networks, we then quantified them. We traced the movement of poultry from the markets where they were sold to the farming system that supplied them. This allowed us to characterize the catchment areas of markets and cities that we could then model using statistical models in order to then extrapolate them to places where we didn't conduct surveys. We characterize the movement of traders within cities, between markets within a city, and the population dynamics of chickens at different nodes in the network. And we first did that using standard classical questionnaires, but then more recently using phone applications that were designed to be used directly by the traders to get more information about the movements. So based on this understanding of the network, we then designed biological sampling studies. And a pattern that was appeared very obvious, and that's also shared in other settings where these viruses are endemic, is a strong spectrum of viral amplification from farms to the markets where chickens are being slaughtered. In markets or in other type of endpoints. In Vietnam, there was nonetheless a wide variation in the prevalence of the infection, and especially of H9N2, which is the most prevalent viral avian influenza subtype, which is low pathogenic in poultry, but zoonotic and a major gene donor in the generation of new variants, including recent H5. So there was a wide variation among endpoints in the prevalence of the infection, and this was associated with the position of the endpoints in the network, the number of intermediary nodes, and was more influenced by the location of the farming areas supplying those endpoints than the location of those actual endpoints. And this suggests that the prevalence we observe in those endpoints, markets or slaughtering facilities, not only result from transmission events occurring in those sites, but also through viral amplification happening upstream the networks. So now, in order to contribute the relative importance of these different routes, we designed a field experiment that we conducted in Bangladesh this time to assess and use the results of this field experiment through which networks were altered and chickens were repeatedly sampled along the network to fit a mathematical model simulating the spread of H9N2, accounting for the population dynamics in this market. And we estimated very high R0, so transmission rate in the markets, with a short latent period, which meant that chickens entering susceptible in the market become infected very rapidly. But we also identified that the proportion of chickens entering the market as infected was substantial, especially for broilers, which are the main chicken type being sold in those markets. So for H9N2 in Bangladesh, we have intense transmission in the market, but also before chickens arrive in the market. And this is not only due to transmission occurring during transport, but also in the very late stage of the production cycles. We conducted studies where we followed day-by-day production cycles in farms and found that the practice of partial harvesting, which consists in selling birds in small groups over a large number of traders over several days, is a practice well entrenched, which allows farmers to navigate the volatile sectors that are facing and reduce the impact of fluctuation in prices on their incomes, but which also generate additional risk for those chickens. And I will talk later about the impact it has on risk mitigation. For H9N1, H5N1, we have a different picture where ducks show high prevalence in markets and are responsible for the introduction of the virus in the market, for the amplification, and ducks in Bangladesh being a very small proportion of the poultry being sold there, less than 1%, they also expose a small proportion of the chickens in those markets, explaining the low prevalence of the infection in chickens. And this is being confirmed by a field experiment which we are currently conducting, by the preliminary finding of this field experiment that we are currently conducting in Bangladesh. So this low prevalence of H5 in markets, combined with the absence of notification of outbreaks in farms, led to the epidemiological narrative that intensive chicken farming is not really playing a role in the endemicity of H5. So we wanted to reconsider that, and so we looked for H5 in farms, and we didn't have to look very hard to find it, whether it is in farms of which farmers were seeking veterinary advice, or in farms that we sampled, again, longitudinally, by really following them day by day. We found them in pretty high proportion of those farms. And while these birds do not qualify as commodities in markets, they do in other situations, including dead birds, offering farmers the possibility to reduce their economic losses. Then, when we sequenced those samples from farms, what we found was that these sequences, you see the dots over there, clustered in the phylogenetic tree, in the timescale phylogenetic trees, away from market sequences which were in the same areas and sampled at more or less at the same time. So this suggests that what we see in farms it results, at least partially, from transmission chain which could be sustained between farms. So here we do not want to exaggerate the importance of intensive chicken farming on the epidemiology of H5N1, but to emphasize that both the lack of understanding of the bias in data generation and the lack of accounting of the context within which actors operate led, quite conveniently, one may say, to ignoring or neglecting the role of intensive farming in endemicity of H5N1. So now, with this understanding of the network structure and how actors operate there, we wanted to better characterize viral mixing along those networks. So first, at the scale of a market, with H9N2, so back to H9N2 in Bangladesh, within a market we have multiple lineages circulating at any one time. And these lineages do not necessarily stay very long in those markets. We have a high turnover. And so we are now conducting mechanistic modeling work to understand the factors that are resulting in this, and especially the balance between the high prevalence at incursion and the high turnover of birds in this market, influencing this lineage dynamic. We also, of course, looked at a higher geographical scale, looking at the viral dispersion between markets in Bangladesh, where we sampled 50 markets across 5 cities in Bangladesh. And we conducted phylogeographic analysis to characterize various dispersions between cities. We found that the overlap between the catchment areas of this market as a significant predictor. So meaning that markets sharing supplied by the same areas were more likely to share similar viral population and to have a viral dispersion between them. And this was significant for all major types, which contributed major chicken types sold in those marketing systems. Then we looked within cities in Dhaka and Chattogram, where we had sequences for a largest number of markets. We first characterized the genetic diversity, which was much higher intra-market than inter-market, meaning there was high genetic viral mixing among markets within a city. And this was interestingly due to the configuration of the trading network, of which the characteristics appeared as a powerful predictor in those models. Despite that, in Chattogram and Dhaka, the trading networks are very different, being driven by different socio-economic contexts in both cities. So I want to emphasize that. You may say that's quite logical that the trading network play a role here, but first, this is the first time that the viral genetic data and network data, which are collected jointly, are analyzed together, and also it allows us to show that that for surveillance purpose, we could consider sampling a much smaller number of markets per city than is being done now, but considering engineering the surveillance in multiple cities with complementary catchment areas in order to better monitor early emergencies. In Vietnam, the geographical structure was even weaker, with frequent movements between and within provinces, and some sites, particularly farms, having multiple distinct strains at a time, with multiple introduction in the sites. We were, of course, interested in H5N1, so this time we focused on ducks in Bangladesh, where we conducted a study across the country, where we repeatedly sampled markets, and we found that the genetic structure, the dispersion of H5N1 was even, the viral population of H5N1 was even less geographically structured than for H9N2, and we hypothesized that it is due to the transport distances, with ducks being transported over much longer distances than chickens in the country, and something we are now exploring. Interestingly, over this study period, the historic clade in the country, which had been endemic for several years, is now slowly being replaced by 2344B, which is the one coding the global panzootic currently. And this new clade, we found four different imports with a timing corresponding to the wintering of migratory birds in Bangladesh, and being related, the sequences being related to wild birds. What is quite interesting is to see that once they are introduced in the country, they spread very widely throughout the country, which likely be associated with them being primarily spread by wild birds. So with this wealth of information on networks and on the pathogens, we are now investigating how different structure of the networks, of the production and distribution networks, can impact the transmission dynamics. We are doing that by we have developed a new agent-based model which simulates the networks of trade, considering the different components, but also the transmission of pathogens. It allows to play with different characteristics of the pathogen we're interested in, not just avian influenza, but also others, and allow us to simulate the co-circulation of multiple strains, and also to reconstruct transmission chains, which can then be compared and used to calibrate the model on the output of phylogenetic analysis. We're also interested in how the intensification as an ongoing process, and by statistically modeling the distribution of farms, building future scenarios for this intensification and how this may impact on the vulnerability of the sector to epidemics. So to finish, a few words on risk mitigation. First, I should say a word on the risk for humans. We have set up cohorts that we are following. We have collected these samples and they are under analysis. But what we expect, like in already published studies, in this setting, we'll find a low level of seroconversion in neutralizing antibodies in humans. An hypothesis for that is a repeated exposure, which results in cross-protection due to antibodies targeting conserved regions shared between subtypes. So we built assays to test that, and we conducted already a pilot study on poultry, on the workers in poultry market and vegetable markets, and found evidence that the prevalence was higher for H9 and to a lesser extent for H5 among poultry workers than vegetable workers, so which seems to suggest this, our hypothesis was supported. And within poultry workers, this prevalence was higher of H5 was higher among workers handling ducks. So to reduce this exposure of humans in market, the first strategy is to close them or to try to reduce their importance. What was attempted in Vietnam, where we analyzed governmental policies of developing industrial and modern animal slaughterhouses. And this had limited impact with this infrastructure being underused for a range of factors that I don't have time to go through now, but just to emphasize that in the meantime, the more informal slaughtering point remain really important and were those associated with the highest risk. So instead of focusing on something which may not be realistic, it may be needed to better target this small slaughtering point. We were also interested, of course, to look into vaccination. Work has been done to characterize the antigenic diversity, which seems to be substantial, and with different subgroups, genetic subgroups of viruses associated with different possible success in vaccination if they are used as vaccine seed. Another approach that was advocated with the work done in Hong Kong over the last 20 years and has been instrumental in the way how policies are being designed was to target markets, implement interventions in markets which minimize disruption of trade by implementing disinfection and other interventions such as reducing the stay of poultry over a one-day period. This first is very difficult to implement, but even if we consider high effectiveness in the implementation of this in our setting in Bangladesh, this didn't manage to reduce enough the prevalence of infection. And this was due to the frequency of introduction of the virus in those markets. So to really make a difference, we need to have interventions not just targeting markets, as it is too commonly the case now, but the entire network, which is not in good news because, of course, it's much more difficult. And I will finish by just emphasizing that we have a high viral amplification and mixing along the network. There is contrasting patterns between viral subtypes, with the network configurations being clearly a determinant of viral transmission dynamics. And the network configurations and the behaviors of actors within these networks is influenced by the structural constraint faced by stakeholders. And within this context, top-down interventions would have a very limited impact. And intervention need to be structural in order to have an impact. Thank you.